Welcome to This Week in Parliament. I'm Joshua Hinkson. Thanks for joining us. The purpose of the Estimates 2023-2024 is to set out the details of the operating and capital spending requirements of ministries for the fiscal year starting April 1st, 2023. The estimates constitute government's formal request to Parliament for approval of the amounts required in support of budgetary spending sought through appropriation bills. Now, during the last few weeks, the House of Assembly engaged in discussion on the estimates for the upcoming financial year, with ministries and their teams making presentations on outcomes from 2022-2023 and detailing their plans. In this edition of This Week in Parliament, we will first take a look at the presentation by the Ministry of Health and Wellness, specifically their approach to the fight against chronic non-communicable diseases.
In a country where 80% of deaths are due to non-communicable diseases and cancer, and 80% of the population are exposed to risk factors of non-communicable diseases, namely poor diets, not much activity, tobacco use, and the abuse, I can call it, of alcohol, we have to be mindful of the NCDs. Effectively preventing and managing NCDs requires a multi-sectoral, multi-agency approach involving both the private and the public sectors. To this end, the ministry continues to collaborate with many of its stakeholders, including international agencies, health-related NGOs, civil society, faith-based organizations, and other stakeholder ministries and academia. Major collaboration continued with international partners such as PAHO and WHO, and of course the Caribbean Public Health Agency and the Healthy Caribbean Coalition.
The issue of improved management of NCDs speaks to issues around clinical guidelines, as well as empowering patients through programming such as the Chronic Disease Self-Management Program, where individuals learn about their disease and how they can play a better role in managing their disease. And we have seen individuals who've taken part in that program have improved outcomes. We have pulled out the Childhood Obesity Prevention Program, which is sort of a cross-cutting program, and we've made that a particular area of focus. Again, tying back to the issue of prevention, the issue of bang for the buck. When we intervene early, when we're able to prevent as opposed to remediate or palliate, we are likely to get much better outcomes. There are a basket of interventions that will help us to achieve a significant bang for our buck, and these are programmed into the NCD strategic plan. The funding for the NCD strategic plan, without the additional staffing, we're talking about one full-time person at the moment, is in the vicinity of $20 million over the 5-year period. Communicating for health, again, very important in terms of not only communicating with our partners in intervening, but the general public. And then surveillance and research, which helps us to be able to track what we are achieving, how things are changing, where we need to put our focus. So those are the key issues from a high level that we are addressing in the NCD strategic plan. And this is the first year that we have our own budget. We would have been under health promotion at or around $200,000. So we have $500,000 this year, and we would hope to be able to get up to the $4 million a year to be able to implement the basket of tools that we believe will make a significant difference in terms of the burden of NCDs in Barbados.
The minister and his team underscored the importance of collaboration in this fight against NCDs. The Diabetes and Hypertension Association of Barbados is one of the ministry's partners. So we spoke with the association's president, Judy Griffith, who shares her perspective of the prevalence of NCDs in Barbados.
So let us appreciate is that it's not one single factor that we need to address. This is a multifactorial issue. It is part of our history, it's part of our culture, it's part of our socialization, it's part of our diet, it's part of our economic situation. It is really multifactorial, and we really need to tackle this from every single angle that we can. However, we recognize that we may not have the financial resources to do all of that. So it's not just the government's responsibility to do something about this situation, it's each and every one of us. It is our responsibility to contribute to the change in where we are already headed. As a healthcare professional, one of the things that I appreciate is not just about looking at someone from a physical perspective in terms of what do I prescribe, what do I recommend. Being diagnosed with a non-communicable disease is really a life-altering situation, because when we look at our history, when we look at our personal experiences with non-communicable diseases, we know that we have very high rates of complications. And let me explain what some of those serious complications are. Loss of vision, amputations, strokes, heart attacks, dialysis. We really have very high rates of all of those complications in Barbados. So it's very difficult to really say, do one thing. And one of the things that I think I also need to mention here is that some persons present with their diagnosis of a non-communicable disease at the stage where they've already developed complications. So what we want to do as an association and as a nation is to ramp up our rates of screening. And when I say screening, I mean to test persons to see if they have diabetes or hypertension or if they're at risk. And if they are, they need to seek medical attention. The other side of that coin is if you know you have a diagnosis of diabetes or hypertension and you have not done anything about it, or you're not actively participating in making sure that those conditions are under control, then you really need to take charge. The other thing is that we need to appreciate that persons need help. One of the things about being diagnosed with a non-communicable disease is that it challenges all that you have known up to that point. And therefore, what do I eat? What do I do about what my lifestyle currently is? And that's where the association is willing to step in. And we have the Chronic Disease Self-Management Program, which is an intensive 6-week program. Each session is 2.5 hours long. And we take you through all the ancillary elements of managing your chronic disease. One of the things we need to appreciate over the last 3 years is that the cost of living has increased. Barbadians are crying out in terms of the prices that they're paying when they go to the supermarkets, the cost of healthy food, etc. I know that this is a challenge, and this is going to be an ongoing challenge based on what the global environment is like. But we need to come up with creative solutions. One of the challenges that I recognize persons have is discipline and portion control. So when we love something, we love to eat it, and we love to eat a lot of it. But then you're consuming calories over and beyond what your body needs to survive. And therefore you are contributing to a lack of control, or you're contributing to your progression towards a chronic disease. So if you considered that, if you look at the portion size of a banana, when you consume one banana, you're consuming multiple portions of the fruits and vegetable servings that are recommended for you to consume on a daily basis. So if you eat one banana and one small apple, you've covered yourself for one day. But we think we have to have one banana, one apple, one mango, and you continue going like that, and you realize, I'm overeating. So let's really get the advice. If you have been diagnosed with a non-communicable disease such as diabetes or hypertension, you really need to engage the services of a dietitian who will counsel you in terms of what you are consuming on a daily basis, so that you will be within limits in terms of what you ought to be consuming to maintain life. What the pandemic has done is that it's really derailed a lot of the health promotion efforts. Health promotion being those things that we want you to do to make sure that you have the best quality of life. I know that's the direction we're moving back towards, but we also need to encourage persons to take care of themselves. When is the last time you had your blood pressure tested? When is the last time you had your blood sugar tested? And I'm talking about persons who don't even know their status. You can have someone who has gone to their physician, had their yearly checkup, and everything is fine, and within 2 months, something goes wrong. So therefore, we really need to keep monitoring ourselves. It's not just taking it for granted that everything is fine, because I am sure that many of us are aware that we have a family history of either diabetes, hypertension, or both. So if you know that it runs in your family, you are at increased risk for developing these conditions, particularly if your lifestyle does not match up with what we've been talking about and what we've been advocating for years. But it will take a concerted effort on everyone's part to ensure that we get back on track. I know the government is committed to creating that enabling environment so that we don't have that burden of NCDs in Barbados. But at the same time, let us be realistic. Our numbers have been increasing and they will continue to increase unless there is something done to ensure that we are back on track.
We realize that the hospital, as I said before, is inundated with the burden of NCDs because of the escalating, the morbidity was increased, associated morbidity with respect to the NCDs. The hope now is to increase the capacity for the primary care setting, i.e. the polyclinics, all 9 polyclinics, so that we can get back on board and to ensure that the risk factors are addressed, people are educated, from the smallest to the oldest. So the plan now is to involve these schools even more. But leading from the school nutrition policy that was just launched, the plan is to go forward to do a national policy that involves non-school entities.
We focus our attention now on the estimates presentation by the Ministry of Agriculture, Food and Nutritional Security. Among the ministry's success stories during this fiscal year have been Project CARE, which stands for Community Agriculture Response and Enfranchisement, as well as the Farmers Empowerment and Enfranchisement Drive, or FEED program. This FEED program was launched in 2019. Now, Minister Indar Weir and ministry officials spoke of the project's purpose, achievements, and challenges.
The Ministry of Agriculture has been doing tremendous work in making sure that we can keep farmers engaged. And we've started the Farmers Empowerment and Enfranchisement Drive, which is commonly known as the FEED program, to do a number of things. One, to make sure that we can give training to people so that they can treat agriculture as a viable career option. Equally, help them to understand what is required to get involved in agriculture, and then give them a sense of business in that training as well, so it can be treated as a business. We've also made sure that we work with farmers to increase our crop production. And in order for us to be able to achieve this, we were heavily dependent on the work of our technical officers, our extension officers, and indeed the Chief Agricultural Officer, the Permanent Secretary, and the team to make sure that we can deliver on this. So under the FEED program, any person can register, be trained, and then be given access to land. The biggest challenge we've had so far is being able to find land with water. So you'll find that the government had to invest a lot in putting in the 1,000-gallon tanks so that people can get access to water. This has slowed down the process, but the program is still ongoing. So people in St. Michael North can easily sign up for the FEED program, get the training, and be allocated land. On the Project CARE, though, what you would find is that this is a faster process because you're not talking about acres upon acres of land. You're talking about a quarter acre to an acre of land. But equally, people in rural and urban Barbados don't have to have land, and that's the most important part. We are using a system which is called the Green Machine that was developed by Dr. Charleston Bradford. And that machine gives you an opportunity to use aquaponics. So you can do your tilapia fish, and then because it's a revolving system, then the water can go up to your plants as well. So you can plant cucumber, you can plant lettuce, etc. And that gives you an opportunity to have 2 bites at the cherry by being able to do fish harvesting and crops as well. And that can be replicated across urban Barbados. We have asked to have available to us
10 for each constituency in Barbados, which gives us a total of 300 that will be available to us. And those obviously will be on the project here, where the chairman and his team, working with the Ministry of People Empowerment and Elder Care, will be able to determine who will be the recipients of those systems. And then we've just received, out of a total of 50, we've just received 15 shade houses from Guyana, 16 shade houses, the PS is telling me, which will be set up here in Barbados. And again, they will be part of the feed program, where we have included schools as well, because we want to make sure the schools are participating in agriculture. And those shade houses will be used in schools, they'll be used at Lears, some at Pine Basin, and of course within the feed program itself, to those farmers who want to take a new approach to farming rather than the traditional open field approach.
Over the course of the last 18 months, I think, we have had a significant push, both on the front in terms of training. To this point, we've trained just over 880 persons through the feed program. The major limiting factor, I think also was mentioned, is the access to lands. Whilst we have a land bank available to us, none of those areas do pose challenges for agricultural production, water in particular, as you mentioned, but also to the slope of the lands, needing to ensure that persons can actually utilize the lands effectively. So we have been working to allocate persons throughout those plantations that we have care of. And the current total who have been allocated to this point is 252 persons across 343 acres of land in various districts. That would include a few new districts that we've essentially re-established or returned to agriculture over the course of the last year and a half. Bath, we've introduced a small group to the Wakefield area, also in St. John. We've re-established the Mount Poya plantation and established about 90-odd acres there for persons to actually farm and to utilize. So there has been a concerted effort to bring what would have been previously fallow lands, previously unused lands, back into agriculture, back into operation. So that has required a significant investment of time, obviously, and funds. The major challenge, obviously, still remains water, and facilitating that is a critical input for agriculture. I think, unfortunately, we can't get around it. So we work closely with the BWA, both at present in terms of delivery of water. We have been facilitating that from a couple of our existing wells, but also in relation to identifying new resources going forward. I think at present there is an exploration that we're hoping can get started in St. Lucie to identify access there that might benefit those in the Mount Poya and also the existing Spring Hall land lease project. So those two critical areas, I think, working with the BWA are the direction that we need to move in to improve that water access.
So we've heard from government officials on the success stories of the ministry's projects. Here now is Ronald Herwood, a farmer whose entrepreneurial efforts were supported by the feed program.
I actually never worked in agriculture until recently after my retrenchment. So for me, I just made the decision to come back home. So we went on the feed program with the BADMC, right? So it was up Ferry Valley. We do some training in crop husbandry, little animal husbandry, right? We do crop management, pest management, etc. We try to get ourselves and other persons well-rounded before, trying to go into the ground, assign persons some land and stuff, right? Even though some might have had a little experience in agriculture, right? It was still good that they gave us the whole outlook as one group, so that, I won't say, well, yeah, I got an agriculture, well, man, no coming, all right? All we was in the same group. It was a good experience at BADMC, yeah. What I can show you right now, all right, these is some beet seeds that went down, but beets take longer to germinate than others, right? These went out after these, because you're doing them in stages, okay? These would be some peas, that I want to plant around the border, my little plot. So we were able to get peas, but still got a little protection. And plus now, peas in your soil will actually add some nitrogen to your dirt, which is very, very beneficial to plant growth, right? These next door here, some Chinese cabbage that I got down, that I can plant shortly. As you can see, they come up pretty quick. And what you have here, excuse me, we can do a little cucumbers this morning. So what I can do for you is, as we are here, we can do a little schooling. I can show you a little technique in how to set your ceiling trays. What I have here, you say got a ceiling tray, but in another ceiling tray. What I would have done, if you can focus in, I would have put some spotting mix in the hatching tray. So then when I want pushing the seed, no, I won't go put any dirt, I would just put another hatching tray of equal proportion on top, put some pressure, and that will keep the dirt and neat compact, but not too tight so that the roots will not penetrate. And still, when I put in the seed and put some light potting mix over it, you cover the seed, but still not be too heavy so that the seed will not emerge properly, right? All right, so that will be phase one. We have done. So what we do, where is it? Right. You got your dirt, you moisturize your dirt. You can't want to put on your seeds in a dry area. I want to wet the top. You want to make sure that all around is wet, okay? You may ask yourself why my water a little brown, okay? But there's a little very diluted fertilizer, right? Just to give the dirt a little nutrient boost. So when the seeds do germinate and emerge, they've got some nutrients to pull from. This is where now you gotta take your time, because some of these seeds are pretty small. As I said, there's some cucumbers that we're gonna put down. I'm putting down one seed per cell. There's some plants or some seeds you can put in 2 or 3 at a time, because plants love company, right? We have this thing, but we like to put down things on the individual. But we as people, we like friends and family. We like to interact, right? When you look at nature, when you look outside, you don't see a one grass growing by himself. They're growing in groups. So when we plant by himself, he ain't gonna do so well. He ain't gonna boy to talk to. He ain't gonna boy to lean on. So like more of these standing crops now, I like to play. If I have beans, for example, right? I like to put 3 or 4 beans together. Okay? What happens there now as they come up? They give me leaning up on one another, so that's added support, right? And then with the extra foliage now, when the beans start to come, okay, you'll have a shade from the leaves. So the sun will be burning the beans, and you'll be getting plenty beans at a time. But one thing I've learned thus far is we need a viable water supply, be it irrigation water, well water, whatever, because there are quite a few areas in Barbados that has water issues. So then now if you want to do farming in said area, it could be like taking away water from the residents. So then now the problem is now getting good irrigation water supply to farmers, right? You want that. What I'm doing here, we're just giving a light cover, right? You don't want to cover the seeds too deep, because when you do that now, when to try to emerge, it's going to be very difficult, and you're going to lose good seeds. Now these times right now, we can't be taking much losses. We want to capitalize on as much product as we can attain. We see how the world turning right now. So we need to dwell on food security for ourselves.
Tell me why that's important. Tell me why that's important.
We need to eat, right? And it's known worldwide that we got a lot of GMOs, genetically modified organisms, right? And we eating genetically modified foods are not good for our body, all right? It's not good for us. And it's been proven, right? We need our natural foods because our body depends on vitamins and minerals to thrive, right? Otherwise, on the carbohydrates, the proteins. But if not, we're utilizing, all right, we're utilizing a lot of genetically modified foods which are lacking in these nutrients and these minerals, right? We're only making ourselves weaker as we go ahead. And as generations turn, our children are going to be weaker. And then until we're no more people, right? So by going organic and implementing some food security, we can add benefit to our children's lives by way of giving them healthy food. My end goal is that everybody in Barbados and the Caribbean and the world as a whole start about planting foods the right way. All right? Anything that's growing in the tropics, we need to remember that. We need to start back planting, growing, rearing our animals. Oh shoot. And that's why you must also be careful. Right? We're in the wind, we're speaking, and then let me see it blow away. That's all right. The feed program gave us a good start with the introduction of the different crops that can be used. Truth be told, that was a very, very, very good initiative from the ministry's part. We were given a lot of handouts, leaflets and what's not about the different plants, their life cycle, how to grow them and things, and their soil types. Get back to nature, right? And plus, the more plants around, the more free you can breathe. Because we know plants produce the oxygen that we need, and we got a lot of vehicles on the road, right? So we need to get our air clean. So how we clean our air? Plant plants, right? We got our ornamentals, which is the pretty plants with flowers and what stuff you want for the beauty, but still you got to plant something you can eat. I would encourage anyone that can get into the feed program to go into the feed program because information is there. They provide the information, they provide the assistance. Everything don't happen at the same time, right? As you will notice now, they even mentioned about the, we're getting around back to pretty larceny, right? It takes time, right? So go to the feed program and learn something so that even if you don't go into a commercial farming enterprise, at least when you grow your things at home, you have a better knowledge of what to do and how to do it.
Very good advice. Well, we've examined the estimates presentation by the Ministry of Health and Wellness, the Ministry of Agriculture, Food and Nutritional Security, along with the perspectives of relevant partners in combating the incidence of non-communicable diseases and a farmer who has benefited from training through the feed program. With This Week in Parliament, I'm Joshua Hinkson. Thanks for your time.